We're talking about another blood disorder, and this blood disorder is called what's primary myelofibrosis. Okay, so what is primary myelofibrosis? It's an interesting blood disorder that you guys would like to know. Another primary myelofibrosis, we'll be talking about the definition, talking about the symptoms, we'll be talking about the diagnosis, we'll be talking about the treatments and the prognosis of this medical condition. So under the definition now, we say that primary fibrosis, also known as what? PMF, is a rare blood disorder that is characterized by what? Abnormal bone marrow cell production, scarring, that's fibrosis in the bone marrow, and also increased production of abnormal red blood cells. Okay, and increased production of abnormal red blood cells, white blood cells, and platelets. Okay, so in this condition, there is no deficiency in the production of blood cells, though, but the blood cells produced are what? Abnormal. Do you understand? So that's also a problem. What are the symptoms of myelofibrosis? Of course, anemia. You have the triad of anemia, that's fatigue, weakness, and paleness of skin. You have an enlarged spleen because these blood cells, they are abnormal and they'll be trapped up in the spleen. Okay, so that's what enlarged spleen is, was splenomegaly. Then you have pain in the bones, that's bone pain. You have weight loss. You have easy bleeding or bruising. You have night sweats, and you have what? Fever. Okay, then moving forward, guys, what are the diagnosis of this uh, primary myelofibrosis? The diagnosis is you like to actually do a laboratory test called complete blood counts, okay? And this will help you estimate the amount of blood vessels that this individual has in their body, okay? And to help you access blood production. Then bone marrow biopsy to examine bone marrow function and scarring, okay? Then imaging test, that's a CT scan, MRI scan, okay? So that I can see the internal environment of the bone, internal environment of the individual, okay? And also, you can use it to evaluate what? Spleen size and bone involvement, like I said. Then genetic testing to identify mutations, all right? So you test for genes like the JAK2, the MPL, and the CALR genes, okay? What is the possible treatment for these conditions? So you can give medications to manage symptoms and slow disease production, like the JAK inhibitors, chemotherapy, and immunomodulatory drugs like the thalidomide. Then blood transfusion to manage anemia. Okay, so definitely the person will be lacking viable blood cells, right? So you can always transfuse blood to actually replace. Then splenectomy. This is a surgical removal of the spleen in some cases, because so that to stop what? The trapping of blood in the spleen, all right? Then that's what is called splenomegaly. Then bone marrow transplantations, that's in eligible patients, all right? So patients that are eligible for bone marrow transplantation can just do it to actually replace the blood production. Then experimental therapies like what? Gene therapy can be used too. Prognosis. Prognosis is basically the you trying to actually say the possibility of the patient recovering from this disease. Okay, so the possibility of the patient recovering from this disease uh, is variable. Okay, it depends on the age of the patient, it depends on the overall health of the patient and the disease severity. So some patients may have a stable course, while others may progress to what? Acute myeloid leukemia. Okay, so median survival is around 5 to 7 years, but can range from 2 to 15 years or more with treatment. Okay, so if you have this disease condition, it is always estimated that okay, in the next 5 to 7 years you must have died. Okay, but if you are having vibrant treatments and the rest of them, then you can actually live for like 2 to 15 years. So primary myeloid fibrosis is a chronic condition, and ongoing management and monitoring are necessary to control symptoms and prevent complications of this medical condition. Okay, so guys, that's it about primary myelofibrosis. Hope you guys enjoyed this lecture. I'll be seeing you guys in the next blood disorder lecture, and bye for now.